once again, I'd like to encourage you to ask questions also via the app. So please, Chieh.
Good morning, ladies and gentlemen. Welcome here in Vienna. It's my first time in Vienna, a very beautiful country. Yeah. I'm Jerry from Taiwan, and we are presenting the performance of a novel smartphone-based HbA1c measurement. This is my disclosure. And we know that when we're thinking about A1c measurement, you will think about these kind of machines, very big machines. However, it's not very convenient, so there's a trend to minimize the machines. So here comes a smaller POCT models. But right now, you can see some of the A1c meters become smaller and smaller, such like this one, the A1c Easy or the A1c Now. But what is the next step? I think the next step is this kind of things. It's a smartphone-based measurement. And is that work or how do we need that in hand? We can see a trend of demand of HbA1c testing. The global volume of a professional POC HbA1c testing is about 43 million tests in 2021. So it's a very high quantity of the tests. And the amount we spent on it is more than 320 million in 2021. So it is a great demand that we spend a lot of money on this kind of tests. And what is the core technique of our device, such like this smartphone-based technique? We call it a PixoTest platform. We actually use the screen of the smartphone as the light source and use the front camera as the detectors. So we can detect the strip color change, and then detect what level is the HbA1c. And these kind of things that it can leverage the existing optical strips, not only the HbA1c, but also other optical strips. And we can expedite the product development from years to months. So it will be very quick revolution of the IVD industry, I think. And it will allow the digitization and synchronize very easily to the health system. So this is actually not our first product. Last year in ATTD, we cooperate with Dr. Fragman in Germany, IDT. He presented for the result of our system in glucose. And the result is very good. With the new accuracy of ISO, more than 98% of our results are within the range. So it's very, very precise. It's in glucose. For this year, we announced the A1c part. So this device actually can detect A1c, but also other biomarkers. So we develop for different slots, so such that you can put different strips with different slots, different size. So in this model, we can detect A1c and lipid also. And just about 1 month ago, we got the certificate of NGSP in Japan. So the results are very good. For the criteria, we have to meet at least 37 samples within 40 samples. But however, we got 40 over 40. The samples are within 6% bias. So it's we just got the certification about 1 month ago. And today I will present the result in China Medical University Beijing Hospital in Taiwan. And we totally enrolled 120 patients. And every patient, we have 6 tests for 3 lots. And we use 5 microliter whole blood with 200 microliter buffer solutions. And for the standard comparison, we use the Sysmex analyzer for hematocrit, and we use Roche corpus for the A1c concentrations. And our criteria of acceptance is over 95% of the blood samples should be within 10% bias. And here's our results. Over 98% of the tests are within 10% bias compared to the references, and it meets the criteria. And you can see the R is about 0.99. It's very, very accurate of the result. Totally 720 tests. When we compare to other HbA1c meters, we can see now such that for the COBAS system is very, actually is a little bit more convenient than the old traditional big meters. It can test the lipid and A1c, however, it can only test lipid and A1c and not expandable. But for others meters such like the A1c Easy or A1c Now, they can only check the A1c but no other biomarkers, but they are more portable. However, with our system, the PixoTest POCT systems, it can test lipid and A1c and other biomarkers also if we establish it. And it is extendable platform, and you can use the web as a dashboard, and you can manage the patient's informations, and even we can cooperate with hospitals or the governments for the data. So I think the most important thing is that mobile health solution should be as accurate as a lab quality. And just like us, we just got an NGSP qualification for that. And it should be an extendable model so that you don't need a lot of small meters, such like A1c a meter, lipid panel a meter, and then troponin another meters. You don't have to do that. You can use just like a small meters on your hand, and you can check different biomarkers as the big machines. And it should be easy to handle the patient's management, patient's data. Why it is important? Because nowadays, I think most of the governments or the countries face the same problem, because the people are getting aging. People are getting older and older, so we spend much more and more money on the tests. However, how to solve the problem? I think there's a trend to decentralize. That we don't have to go to hospital every time for just a simple A1c or glucose test. You can do that near your house, such that some of the countries has already have the medical clinics. I think most of the countries have a lot of medical clinics. And even some have some mini clinics in the retail stores or in the pharmacy stores. Sometimes you can have your blood test in the pharmacies. Or when you are getting old, maybe you are in nursing home, you can have a test in nursing home also. And with such that we have partners in the United States, they try to develop the nursing to your house and check every time at your house of your blood glucose and HbA1c levels and give you educations. At your house, you don't have to go to the hospital again. So I think that's a trend to decentralization. So today's conclusion is that data management and the healthcare economy are more and more important, especially right now in the aging society. And PixoTest POCT A1c utilize a smartphone-based system which shows comparable results to the standard chemistry machines. And mobile health solution is a trend of IVD. And among these, PixoTest system has got standard certifications such like the NGSP. So thank you very much.